Any volunteers? Anyone from the back, please?
We've got a volunteer.
I'll volunteer.
Go on then.
Yeah.
Case study 3. Bob has attended the genitourinary clinic at his local trust hospital. Bob is seen by Dr. Gomez, who informs him that he is HIV positive. Dr. Gomez consoles Bob to contact his sexual partners to inform them of his status. Bob starts a course of treatment. For the last 18 months, Bob has been in a relationship with Sue. They are expecting a baby in 2 months' time. Before this relationship, Bob had a series of sexual partners. On a subsequent visit to the clinic, it becomes clear to Dr. Gomez that Bob has not told Sue of his HIV status. Dr. Gomez is aware of the impending arrival of their baby and tells Bob that steps should be taken to assess whether Sue is positive and whether the baby is at risk so that, if necessary, treatment may be started. Bob adamantly refuses to tell Sue and says that if she is told without his consent, then he will stop his course of treatment.
So what should Dr. Gomez do?
The second one.
He's got to force him to tell her. Or because there's a risk to the baby.
With doctor-patient confidentiality, though, he probably couldn't. But he could just make her have or ask her if she wants an HIV test, couldn't he? He doesn't have to tell her about the guy. He should just say it might be a good idea to have a test.
Isn't he? I mean, that's kind of indirectly.
Yeah.
Really?
They should be like, why?
Yeah, but like.
Sorry, coming for an HIV test, we're not going to tell you why, but have it anyway, just to be on the safe side.
But as a doctor, you wouldn't be allowed to betray whatever the guy's confidence. So Bob.
This is again about confidentiality and stuff.
So it's like your only course of action.
There are 2 ways.
Bully him into telling her.
Yeah. No, there are 2 ways of doing this.
Really bully him.
Just every day.
Who would you need to get the consent of to test the baby?
Oh, the baby will be tested.
So you could test the baby
Yeah.
without either of them not knowing?
Yeah. Because the thing is, what happens is
the risk is when the baby's born.
not in the belly, but when the baby's born.
Infected
area. Lots of babies at the moment, they are in many. Yes, you need to see if the baby's got because they're checking for Down syndrome.
Yeah,
so when they check
in Africa, they check for things.
During pregnancy, that's
Yeah.
No, but when you're born, there are some screening that you go through, and it gets also the. But the thing is, you need to realize that in this country, if you've got a partner who passes HIV to you, and they knew that they had HIV and didn't tell you, you go to jail. So, if the doctor is aware,
if they knew that they had HIV and didn't
yeah.
then they go to jail,
Yeah.
You said the other way around, the person that gets HIV goes.
So you could just tell them
No,
that.
the person who passes the HIV, if they knew previously that they had the disease, and they still had sex, unprotected sex with the other person and passed it on, this person is going to be taken to court. However, as any other criminal situation, if you're aware of something that you didn't let the tribunal know, because the doctor will be called into court to know if this person knew this condition or not. Do you see what I mean?
So you can just tell the guy that he's going to go to jail if he doesn't tell anyone.
That's a way of explaining to him that that's one of the reasons. And obviously, what you need to go through is there is a possibility of we obviously need to test your wife. So if your wife is contamined, there is a way of saving the baby from being contamined. So, but the birth needs to be done in a different way. It can't be a normal birth. It has to be cesarean.
Yeah.
And so, for these procedures to take place, you need to explain the patient very well. You need to have a contact with the patient very good, and explain to them and try to convince them, obviously, you can't just break yourself, but you need to bring it up to the hospital team, and it's going to be not just down to you, but it's the whole decision together. It's like if you think that someone's being a kid's being kicked by their parents, it's far too much, and you need to report to the hospital.
That's different though. You know that there's a criminal offence happening, so you have an obligation or a duty to report it. To tell someone's partner that their husband's HIV positive.
But that's a criminal offence.
It's not within your power.
You can't tell them, but you.
Specific clinical condition is slightly different.
Yeah, but that's
what about the baby's rights?
Yeah, baby is involved, so it's different.
No, that's not just the baby, but the wife as well. Because if she's pregnant, they had unprotected sex. She wouldn't be.
Yeah, but you can't tell someone.
You can't tell them, but like you
But
said.
that's a criminal offence.
But I'm sure that he would tell her anyway if he knows that he can go to jail. So you might as well just tell him that, and then he'll be like, oh, okay.
Let's just
correct me if I'm wrong. I might be. Yeah.
But nobody is right.
Yeah.
Or wrong.
I don't know the medical ethics that well, but because Sue could have an illness problem, right? That HIV positive, obviously. I think the doctor maybe might have the right to tell her, only just because the fact that she has a risk of carrying HIV positive. Maybe. Obviously, it will breach the confidentiality, what you're saying, but still, because the fact that she is likely to have this HIV, maybe she could, he could.
To be honest, I doubt if the doctor would do that, because doctors get these kind of headaches a lot, they just totally ignore it. If the person doesn't give.
But the other thing is the pregnant lady will know anyway, because they go through so many. One of the first tests that they do when they get pregnant is HIV.
Yeah.
I worked as a phlebotomist, and I've done it so many times. They get like 15 tubes, and there's always HIV test for pregnant ladies. So
that's
if
true.
she's
It is
infected,
procedure. Yeah.
she will know anyway.
She will find out anyway. So
She'll find out.
Supporting what Shari said, I'm just going to read a little thing that the Guidance Confidentiality report said in 2009. It says, I'm just going to read it to you guys. It states that the disclosure of confidential information without the patient's consent can be justified to prevent risk of death or serious harm to third party. So what it's saying is the doctor can go and tell Sue because if it's a risk to her life.
Oh, good.
It's
So he can go behind it.
yeah.
That sums up everything.
Yeah.
So from what you're saying, consequentialism overrules confidentiality.
Yeah, sometimes anyway.
In
Yeah.
certain
It's
cases.
just, I guess it's just because it's a criminal offence. And it's just the law contradicting itself. The law says that you should keep the confidentiality of the patient, but the law also says that you should
Protect life.
you should
First, do no harm.
yeah, you need to prevent harm, and you need to provide care. And Sue could possibly have HIV, and she needs care, and so could the baby. So it's the law contradicting itself, and you need to